You're listening to the new media. You're listening to Mitchell Talks. Learn more at MitchellTalks.com and follow me, Scott Mitchell, on Twitter at Mitchell Talks. Welcome to a Mitchell Talks series, the proposed tobacco tax increase and why health advocates are pushing so hard. Our guest is Dr. Bob McCaffree, physician and professor at the University of Oklahoma College of Medicine and Associate Director of Policy with the Oklahoma Tobacco Research Center.
And I've mentioned the Medicaid cost of smoking. I think the one thing that people don't focus on is the fact that a large percentage of our newborns are covered by Medicaid in the state. My wife is a neonatologist, that is, she takes care of newborn babies, and this is something that she has really been working hard on, that is smoking during pregnancy and actually in families after the child is born. But we know that smoking is associated with low birth weight, premature birth, and one time I did a quick calculation on that, and if we could prevent all premature birth and low birth weight babies in the state who go into neonatal ICUs, that would cut into our Medicaid cost significantly. If we had zero smoking during pregnancy. So that's something else that we need to work on. And I think that, by increasing the tax, we will reduce the number of smoking mothers just by that number.
I'm sitting here shaking my head. How prevalent is it for women who are pregnant to smoke? It's 2017, and I couldn't think you could find anybody would be for that anywhere, regardless of party or even your stance on tobacco.
Well, in our Medicaid mothers, the latest figures that I've seen is it was over 30%. And unfortunately, even if they stop smoking during pregnancy, during some part of pregnancy, they start again. Most of them will start again after they smoke. Now, we do have programs to help people. We haven't really talked about that, but through the Tobacco Settlement Endowment Trust Fund, we have the State Quit Line, and this is specifically designed to help everybody, but also they will provide nicotine replacement therapy for people whose insurance programs don't cover that. So this would help tremendously in a lot of these situations.
Just one quick additional thought on this. When a baby is born from a mother who's been smoking, what sort of health issues does that baby face?
Well, first of all, they as I said, they're likely to be or have a high chance of being small for birth weight and being born prematurely. So, of course, if they're born prematurely, then they still have to develop all their organs. For example, their brain's not fully developed yet, their lungs are not fully developed. So they have a higher chance as they grow of having respiratory problems, ear problems, breathing problems, asthma, and other types of lung problems. So it's I'm certainly no expert in this area, but it can affect their health long term just from being born of a smoking mother. But what's on the line really is the future of Oklahoma. I'll just put it that simply. I told my own representative when I visited with her just 2 or 3 weeks ago, I love living in Oklahoma, but I don't want to live in a third world country. And that's what we're becoming. We've already cut education down, so many of our districts have 4 days a week. Somebody joked and said, well, the good news is the legislature still has another 4 they can get rid of. But that's a sad comment. So I really think that we need a focus on doing those things, those practical things that there's no reason not to vote for this bill, but this is a first step, if you will, in our saying, we need to pull ourselves up by the bootstraps. As Oklahomans, we're proud of the fact that we help each other. So what's on the line here really is the future of our state. If we're satisfied with being at the bottom of every list, every good list, then we can just go on as we have been. If we really want to do something to help this state, we need to start with doing something very simple. And this is, I recognize some people say it's a tax. Well, I think back to the famous quote about a foolish consistency is a hobgoblin of little minds. Let's get past that. This is a benefit. It's a benefit to the state. It's a benefit to the poor people of the state. It's a benefit to the entire state. And there are a lot of myths that have been thrown out there, and the tobacco lobbyists really push on these myths. They're all wrong. Every one of them is wrong. There is no reason not to vote for this tax. If we want to talk about the specific myths, we can, but I can tell you we have data on every one of them, and they're just lying about these. So, this is a key element that we need to put in there to try to improve the state of Oklahoma and the health of our people.
Last, let me ask you a question that might seem 10 years ago might seem impossible. The cigarette tax increase is being advanced by leadership in both houses and by the governor. The headlines this morning indicate that Democrats are not supporting this. Now, for those, it's not simplistic. There's multiple layers, to be fair, to both sides. For the folks because it's a tax increase, it would have to have the 76 votes in the House at least. What would you say to the Democrats, Representative Inman and the Minority Leader and Senator Sparks on the Senate side in terms of what's on the line here? Because, again, it's not to be simplistic about it. There are multiple reasons why that they appear to have locked up against the cigarette tax. But your comment as to what's on the line, at least for Democrats.
Well, I know that the Democrats are trying to get more out of this, and they have clearly there is a different philosophical view between the Democrats and the Republicans.
And this is not about the cigarette tax per se, correct?
Correct. So I understand the Democrat viewpoint. I also understand the Republican viewpoint. I also know that there are many other things that we can do to help our financial situation in Oklahoma, some of which are far less appealing to Republicans and to Democrats. But once again, when we get to the cigarette tax, I think that should be a nonpartisan. That shouldn't have anything to do with political philosophy or anything else. To me, it's a straightforward issue, straightforward question. As I said several times, I think it's a moral question. But in terms of the Democrats, I think that they could still fight for the things that they feel strongly about and not hold this particular issue hostage at this time. At least I would hope that they could do that. Whether that is a political reality at this time, I don't know. But it really is strange for those of us who've been in the public health area for many, many years. It is strange to see the Democrats on as a group that we're trying to convince of what is, to me, a straightforward public health issue.
Well, Dr. Bob McCaffrey, it's a pleasure to meet you. Thank you for your thoughts, and we'll check in again very soon.
Thank you, Scott. I've appreciated this and enjoyed it. Thank you.
Same here. You're listening to the new media, the Mitchell Talks Network. Learn more at MitchellTalks.com and follow me, Scott Mitchell, on Twitter @MitchellTalks.